Thank you, everyone. My name is Sam Vaughn. I'm the director of the Scott Bieler Child Advocacy Center at BestSelf. We're incredibly honored to be a part of this group today. I first want to start out by thanking Angelica for an incredibly powerful story that I think motivates all of us to continue to do the work. BestSelf is a proud partner with many agencies that are listed here today: Eat Well Buffalo, Catholic Charities, BPPN, and of course the United Way. And we just wanted to be a part of this group to talk a little bit about safe sleep. Safe sleep is still the leading cause of deaths for infants in the United States. In 2022 alone, approximately 3,700 infants died suddenly and unexpectedly. These are largely preventable deaths. Erie County has seen this crisis firsthand. In just 1 month, as an example, the Erie County Medical Examiner's Office investigated 6 deaths of children under the age of 3 with suspected links to respiratory illness and unsafe sleep practices. The ABCs of sleep, which are on all of the pack and plays, which can be provided by the CAC and BestSelf at anyone's request, have the ABCs on there, of course, as it was mentioned earlier at the start. That means alone, on their back, and in the crib every time for their sleep. This has helped, since the launch of the Back to Sleep campaign, SIDS rates to decrease by 50%. Proof that education works. I think that's the primary example we're taking away from today, is the education around safe sleep is critically important for all of our partners. Soft bedding is a silent danger, and safe sleep incidents should really exist with just limited pillows and blankets and a child sleeping like it is demonstrated in here in front of you. Bed sharing poses a serious risk. As much as it is important for that child to bond with that parent, nearly half, 46%, of sleep-related infant deaths occur while the baby was sleeping with another person or animal. Even a loving and well-intended parent can't unknowingly put their child in danger. The most vulnerable window is the first very few months. Most safe sleep-related deaths happen when babies are between 1 and 4 months old, and 90% occur before the 6-month age mark. This is when safe sleep education matters the most. Prevention requires a community effort. I always think about Buffalo as the city of good neighbors. These are our neighbors. They're little neighbors. They'll become big neighbors. They'll become neighbors who remind us of what it means to be a good community. BestSelf being the largest behavioral health provider in Western New York, we really think about the impact that that has. Each clinic you can walk into at BestSelf is going to be able to have a conversation with you about safe sleep, but that work doesn't happen without this collaborative partnership, and certainly doesn't happen without community feedback. I'm so honored to be a part of this group. I'm so honored to represent BestSelf here today. And if I can add anything else to what was already said, which was incredibly important, is just to remember that you can always call us. Every one of us in this room is dedicated to this mission, and every one of us has a phone number that you can call. I think Angelica's story really speaks the most power to anything that we said here today. So I want to lift that up again and just thank you all for being able to participate. If you ever need to get a hold of us, feel free to reach out to BestSelf or the CAC at 716-886-5437 and bestselfwny.org. Thank you, folks.